Welcome. This week in lab, we're going to be talking about comprehensive fitness evaluations, what they compose of, why might we want to do them, some of the environments that we might do them in. Um, this lecture today is really just to kind of give you guys an overview or that background knowledge going into our in-person lab. So we will meet in person for lab for our comprehensive fitness eval. But this is really just to give us that background before we go in. We have limited time to get through a number of tests. So hopefully this should be fun. So in thinking about why we might want to conduct a comprehensive fitness eval and why we do it so often in our exercise physiology fields, is really taking a step back and thinking about what are our, what is general population? What are their health risks? What are their health status? Okay. So in thinking about that, we know that about 1/3 of Americans are classified as obese and about 2/3 are classified as either overweight or obese. So over a 50% majority of our population are experiencing what we call metabolic disease or at risk for some sort of metabolic disease. When we look at that, overweight and obesity have been linked to increased risk for different types of cardiovascular disease. Some of those having to do with increased triglycerides. Some of that has to do with increased blood pressure, so hypertension. If we have impairment of glucose tolerance, that's another risk factor of obesity. And that's another product, right, of obesity, overweight, and that can be that increased risk for cardiovascular disease. So in thinking about that, right, we know this makeup of our population is experiencing high levels or, high currents of this increased weight, whether it's overweight or obese category. They're living with this increased risk. But what we know as exercise specialists and physiologists, as you guys go on into the field and explore that, what we know is we've seen it so far as the benefits, right? Numerous health benefits that we can gain from regular participation in physical activity and or structured exercise programs. And when we're thinking about that, we're thinking, hey, we know we might have an increased disease population. So what we know from an exercise standpoint is we can help clients and participants manage some of those side effects or those risk factors. So we can increase exercise to reduce this risk of cardiovascular disease, reduce our category of obesity or overweight, so losing adipose tissue. In order to do that, for us to get set up and for us to know what to do with our clients, that's where we start to do this comprehensive fitness evaluation. So we want to be able to say, I can assess where your current baseline is. We can talk about your disease risk, or if you're high or your weaknesses in certain areas are contributing to your risk factors. We could also look at strengths of that comprehensive fitness eval and say, hey, you're doing really well in this area. Let's keep that up. That's actually helping, reduce your risk, or that's helping you feel better. So it gives us kind of this overall picture on how to look at our population or our clients, where they're coming to us from, and gaining that better picture. Your baseline body fat percentage is 35%, but you tell me, hey, I want to lose 100 pounds. That might not be realistic or reasonable, or I can use, different values that I obtain in my comprehensive fitness eval to help guide us on making more attainable or those SMART goals that we've seen so much in the field. But they're really effective in the way we use the values from our fitness evaluation on how we talk with our clients and how we cognitively, get them to think about shorter term goals because they become more achievable. And for you, they become more successful at achieving the goals that they want, right? If they're not achieving their goals, they're going to say to you, well, I don't want to keep doing this, right? If we make them, hey, I want to run a marathon and I've never run in my life. Setting up that marathon goal is important, but how are you going to set up or motivate your clients to maybe do more reasonable and attainable weekly or monthly goals? And we can use that data from the comprehensive fitness eval to do that. Cool. All right. So one of the biggest debates, if you go across different certification programs, if you go to different places, there has not been identified this optimal testing order for multiple health-related components. So if I know I'm going in and I want to test strength, we know we want to put strength first in our order of evaluation. Or if I know I want to go in and I want to test cardiovascular capacity, I'm going to go in and test that first, so I'm not fatigued in other realms. When we consider doing multiple on the same day, so what we're going to do in lab, we're going to do body comp, cardiorespiratory, strength, and flexibility. how do we want to think about organizing that testing order so that I know my client is giving best in the areas that I'm of most interest or of their of most interest. So according to the ACSM, they'll give you your recommended. NSCA is going to look a little bit different. So if you're strength oriented, your order might look different. So just knowing what physical components do you want to evaluate, and how are you going to make that testing order of most benefit to your client. If I did, let's say I wanted to do cardiovascular, but I tested muscle strength and flexibility all before I did my cardiovascular test in that 1 hour period, that's going to significantly put my client at a disadvantage for their optimal cardiovascular fitness. If that's the true value of that I want, maybe they're a marathon runner and you want to get their tempo, or their, we did ventilatory threshold. If you want to look at that, you would want to do that test first and then kind of maybe get a general sense of their strength. It's okay to do that after. What they recommend, the biggest take home from this, is just thinking about giving them enough time to allow their heart rate and blood pressure to return to baseline between the tests that you are going to conduct. So give them some rest in between, allow their stores to replenish, and that way they can, perform to what they can. So how we talk about the comprehensive fitness evaluation from here, this is kind of going to be your general order. So we always want to make sure we get consent, and we walk them through that, pre-participation health screening. So that algorithm, right? Those 3 questions based on previous physical activity, desired intensity, and then known cardiovascular, renal, or metabolic disease, or signs or symptoms of those diseases, right? That's part of that. We want to initially get that before they start any testing. The next is we're going to do kind of our body weight and anthropometric measures. So height, weight, BMI, circumference, and body composition first before we get them kind of exercising. After that, we'll be doing our cardiorespiratory fitness and then our muscular fitness components. And then the last thing we finish with is usually flexibility. They've warmed up through the entire test. And then that way flexibility is usually after strength as well, to not diminish kind of that strength output. This is kind of your general components as well as your general order that ACSM recommends for overall multifaceted components of fitness for this eval. The green components there are kind of that you can couple muscular strength and muscular endurance as muscular fitness, but those 4 categories that we are most interested in is body composition, cardiorespiratory fitness, muscular fitness, and flexibility. So you can count those 4 as your kind of major overarching areas of fitness that we want to know a little bit more about as exercise physiologists. As we move into the testing, right? So when we know our order, we're going to get consent, we're going to do pre-participation. The next couple of things we want to consider is building a better environment for our clients. I think all of us as instructors have talked to you about how many people come into the exercise testing lab and have never been on a treadmill or haven't done an exercise routine, haven't ever met with a trainer before. So normalizing this environment for them can help them feel more relaxed. So in thinking about that, some of the recommendations for that. So thinking about controlling test anxiety medications, like that they're taking what they need to on the day of the test, the timing of the test, or your information going out to them to make sure they're not eating right before or a large meal before their test, going to the bathroom prior to testing, room temperature can get tossed around in there, and then any other environmental factors that you want to think about considering. So maybe it's an outdoor test that you're doing, you're choosing a field test. Thinking about doing it in the rain, right? That environment can be a big factor in making sure that environment should be as least compromising as possible. So one of the ones I love to talk about most is one of the biggest ways or one of the best ways to minimize subject anxiety or subject fear around the test itself. They have no idea what to expect usually across a comprehensive fitness eval. It's usually their first time in that environment. We do get the luxury of kind of being more of a clinical environment, which is nice. But one of the biggest things there is to really discuss and adequately explain or talk them through what they can expect for each of the test procedures that you're going to do. So for body comp, hey, we're going to do height and weight. We're going to also do some circumference measurements, and then we'll eventually pinch you for skin folds. So talking them through that allows them pinching for skin folds. If you just tell them, hey, we're going to do skin folds, they might not know what exactly that's going to mean. So really taking them through what to expect. It could be general in that regard. You don't have to tell them each site that you're doing in full detail, but thinking about how I can explain the test to them to make them more comfortable in knowing what to expect for each test. So one good example is body composition. The next might be the GXT or the treadmill test. Hey, we're going to get you up on the treadmill. We're going to get you exercising. It's going to automatically increase in speed and incline. We're going to be taking blood pressures, while you're on the treadmill, kind of demonstrate how they're going to put their arm up on your shoulder, right? So talking them through that really can reduce that subject anxiety and reduce that, fear of being in this testing environment. Thinking about your demeanor as well. So the more confident you are, the more you're able to explain these tests, the better you can put your subject at ease. So in order to be able to explain these tests, what we're going to do next is just talk about each of those components of fitness. So body comp, cardiovascular, strength, so muscular fitness, and flexibility. But we're going to talk about why might we want to measure this component of fitness, and then just discuss briefly some of the ways that we can do that. Anywhere that you see a green box on the following slides are going to be what we actually test in our exercise testing lab here at Ohio State. You have choices on what you want to test for each component, but the way that ACSM kind of describes that is, hey, for body composition, you can choose one of these measures. For cardiovascular, you can choose one of these tests to measure. Okay, so you have choices, but in those green boxes or in those green texts, that's going to be what we end up doing in lab. Just to start us off, we're going to talk about body composition here. So what body composition is really our ability to measure some percentage of body mass as it relates to fat mass or fat-free mass. So it allows us to see that percentage or that makeup of body fat within a subject's full body weight composition. This goes back to that BMI versus body composition kind of discussion. So if we have just weight and BMI, we don't really know what that makeup is on the person's actual skeletal frame, right? We don't know if it's muscle mass, we don't know if it's fat mass. It's just, here's your ratio of height to weight. When we get into body composition and why we like to measure more of this two-compartmental model, right? Fat mass versus fat-free mass is the more we know about fat mass or adipose tissue, the more we know about health risk, right? So the more adipose tissue we carry or excess weight that we carry, especially around that midsection, that increases or greatly increases our risk for developing cancer, coronary artery disease, hypertension, diabetes, and so forth, right? So knowing what this breakdown is allows us as exercise physiologists to talk with our clients about, hey, you might be at an elevated risk. Maybe this is an area that we can focus on. Can we reduce body composition? So can we reduce adipose tissue versus or increase lean mass, right? So changing that composition as opposed to just your scale weight, right? Because we know that has an effect on health risk. Some of those measures here listed out, we call them anthropometric methods. So height, weight, body mass, circumference, skin folds, we're going to do all of that in lab. Other ones we can do or is underwater weighing, so density, like looking at density of fat mass and lean mass. One you can do underwater. We've got a bod pod that does air displacement. We have a DEXA, I think that we've all kind of talked about now. There's some bioelectrical impedance analysis. So your in-bodies, a lot of you guys might see at the gyms, are all different ways that we can measure body composition. Switching gears, the next kind of test up on our list is cardiovascular fitness. So we know this ability is how well our heart and our lungs, right, can perform or use this large muscle group to moderate high intensity exercise for prolonged periods of time. So we think cardiovascular fitness, aerobic capacity, this ability is going to depend, right, on that pulmonary, cardiovascular, and skeletal muscle system and how they work together. So why we want to measure cardiovascular fitness, right? We think, okay, so heart, lungs, and skeletal muscle, so it tells us our fitness capacity usually. But levels of cardiorespiratory fitness are significantly associated with all-cause mortality or death, right? So lower levels of, you can see in this graph here, lower levels, we'll go right here, of cardiorespiratory fitness or aerobic fitness is associated with a high percent or high number of all-cause mortality, meaning you're higher or risk for cardiovascular related death or illness. As we become more fit or cardiorespiratory fitness increases to the right here, we see a decrease, right? A significant decrease in that risk for relative death or illness as a product of, or as a risk of like low levels or higher levels of cardiorespiratory fitness. So we want to think about using this value as not only it could be used to monitor, right, anybody, where are they at, right, in their aerobic fitness or their cardiorespiratory capacity, but it helps us look at, as part of a prevention or rehabilitative program to say, hey, maybe we're here, can we track progress over time, or can we change from one score of aerobic fitness to a better score to decrease that risk. So some of the ways that we do that, right? So we've done the max testing with the metabolic cart. So we directly measured VO2 through the mouthpiece and the cart exercise test that we did. But we've got to remember that that might not always be feasible or safe for the clients that we're working with. So we can always estimate VO2 through other sub-max tests or other max tests where we're extrapolating heart rate. So thinking about how we use that, so we want to know the reason of the test, the risk level of our client. Should we be taking them to maximal exercise, right? If they're not cleared or our pre-participation doesn't indicate that they should be exercising at moderate to vigorous, then we should consider that submaximal test. We know that for a max test, we want participants to go to maximum exertion or fatigue. Again, that might not be appropriate, or some might not actually get there. So we rely heavily in our testing lab a lot more on this submaximal exercise or extrapolating heart rate through whether it's that graded exercise test. So in the lab, we'll do, as you can see in green, a graded exercise test. We're going to use heart rate and workload from the treadmill test that we choose to extrapolate their VO2 from the test that we collect. Again, you can do field testing. You can do, again, a graded exercise test, but you can do direct measured or indirect measured, so kind of that sub-max versus max. You can do the bike test, again, that we did, right? We looked at that workload and VO2 on the bike test in lab. There's other forms of step testing as well that you can use to measure cardiorespiratory or cardiovascular fitness, okay? Again, that green one's going to tell us what we're going to use in lab, but just so you guys can start to see how there's different ways that we can measure each component of the test. If we go back to that main page, the list out of cardiorespiratory fitness, body comp, right? These are the tests that we're choosing for each of those components. Another one of those is muscular fitness. So there's two different things that we can measure with muscular fitness, but overall, right, we've got muscular strength and muscular endurance as part of this field of muscular fitness. Strength is going to tell us how much force, or the maximal amount of force that can be generated by that one muscle group, right? So we've done the leg press or we've done the bench press, right? And we've measured muscular strength through either the 1 repetition max, the 3 to 5 repetition max, or the 10 repetition max, right? So different ways that we can measure maximal force by a specific muscle group. This allows us to understand, right? So why are we doing muscular fitness? So we want to know potential strengths and weaknesses in muscular strength because it's directly or highly related to ability to conduct a daily activity. So whether it's in our age population or as you age, strength becomes a big indicator of, can I live independently or do I need help doing the things that I'm doing? Getting in and out of a chair, right? That's your standard sit and stand. If we don't have, or we're not assessing muscular strength over time, we might miss somebody's risk factor for projecting and not being able to complete those activities of daily living. So we know push, pull, carry, a lot of women, right, we have to carry kids, right, our strength across time becomes a big indicator of what we can do on a daily basis. When we think muscular strength and muscular endurance, right, and why they're health-related components of fitness, right, what we can look to improve or why we might incorporate or want to look at muscular fitness is its impact on bone mass, right, which is a direct relation to osteoporosis. Again, bone mass or muscle mass. So we look at, okay, if we know muscle mass or strength, it's directly related to sarcopenia, right? So how we're starting to relate this back to, or how we're talking about this with our clients of, hey, we want to measure your strength because it'll be a good indicator, or, it'll help you, right? Let's say in their medical history they do check off osteoporosis, or maybe they're osteopenic, or they have osteopenia, which is that pre of osteoporosis, so that breakdown in bone, right, or bone mass. We want to measure your muscular strength right now, and we want to look at progress over time. If we can increase strength, right, we might have an indirect effect on that bone mass, or direct, but we might not be able to measure that. But we know from a strength standpoint, they're going to be able to decrease the risk of maybe significant progression of that disease. Another big one with muscular strength or muscular programming, how it relates back to health, is this glucose tolerance. So when we do resistance training, we change our ability for insulin response, glucose breakdown, that kind of stuff, which could be very pertinent to diabetics or pre-diabetics, so helpful in their lifestyle management. So our results, again, we can compare them across standards, so we can talk with our clients of, hey, maybe you're in the really poor category, that might put us at risk. We should think about, incorporating, more of this into our program. Again, we could look at how this might help us write a more individualized program, or we can show our clients progress over time, especially strength. That's kind of a fun one to say, hey, right now this is a great baseline, like getting them into resistance training and allowing them to see that progress over time in strength. So maybe I'm lifting, I didn't think I could lift the bar. Awesome, we're working together. All of a sudden you're throwing 10s on either side of the bar and they're doing 3 to 4 sets of those. And like, I never thought I could do this. Like, that progress over time becomes kind of one of the most fun things to watch your client all of a sudden get really excited about. Again, different ways that we can measure that. So just, again, your definitions of strength versus endurance. For strength, right, that's that maximal force. Usually we see that less than 3 repetitions with max force. Ways that we can measure both statically or dynamically. So static would be that grip strength or hand grip test that we did, or we can do the 1 RM or multiple RMs. Max strength, we can still look at our 1 RM or our estimated 1 RM, even if we take our client to a multiple rep max. Okay, so we talked a little bit about this in lab, but our muscular endurance on the other side is usually greater than that 12 repetitions to fatigue. So you're going to say, hey, let me put some percentage of your 1 RM on there, so like 50 maybe, and then you're going to say do as many reps as you can. So that's kind of like the push-up endurance test. That might be a plank test, right? You're holding out for fatigue as long as you can, or you're completing that repetitive muscle action over a period of time until you fatigue. So usually we see that greater than 12, greater than 15 repetitions. One of the tests that we can do there is the push-up endurance test, which we're not going to do in lab, but it's, again, another one that you could pick up for muscular endurance if you're more interested in endurance for your subject. The last one that we measure in lab is flexibility. Right, we know this is our ability to move a muscle through its full range of motion. A couple things affecting that, right? Joint capsule makeup, flexibility, right, or the distendability of that joint, making sure that they have adequate warm-up. So the way we place flexibility within our testing allows it to come after their walking or running test and after their strength. That way their body has that time to do that warm-up. They've run on the treadmill, they've done some strength training. So that'll, if you're doing it solo or on its own, you want to think about, okay, am I getting warm-up for them prior to this flexibility test? Some of the ways that we can measure that is through the goniometer, which you guys are all going to dive into if you get into PT school. But another one that we do in the lab, and that's kind of mainstream across, is this Canadian flexion test or sit and reach test. We use the box. We'll show you guys how to do that in lab. But it looks at that lower body hamstring flexibility with some thoracic extension there. So now that we've gone through all 4 of those components, so we've done body comp, cardiovascular or cardiorespiratory, muscular fitness, and flexibility, right? Those are our 4. Now we want to say, okay, we know why we did those tests. We've explained to our client a little bit about why we did those tests. And now we really want to go back over those results with their client. So deciding whether you're going to compare progress over time, if this is your second follow-up or comprehensive fitness eval, or if it's your baseline, how are you discussing those results with them? Looking at normative values, right? Maybe from a health perspective, hey, we know
kind of going back to pulling from this lecture on, okay, why were we doing this test, and how can I explain this a little bit more to my client on what those results mean for them. Talking about goals and limitations, so asking them what they want from their program, right? Is it health? Is it weight loss? Do you want to get stronger, right? So some of them that come to you are saying, hey, like, I feel really weak after treatment or whatever it may be. I want to gain muscle mass, right? It might not be about weight loss. So knowing that's going to help you, maybe you are more focused on your strength eval or your strength testing as opposed to your cardiovascular. Asking them how many days a week, how long each session they can commit to, because it'll help you better write that program. Then the last piece of that is kind of putting that together and being able to create that exercise prescription using the test information that you just gathered right from that comprehensive eval. And then the above questions that you ask them to start to guide now, okay, here are your results, your strengths, your weaknesses, and then pairing that with their results or their goals going forward. So what to expect from lab. Again, this is just the order that we do it in our exercise testing lab, just with where our equipment is, and then having to move down to our body comp or our strength lab. So we'll go body composition, circumference, and skin fold. We'll do waist and hip. And then the skin folds will show you guys. We're going to do a rated exercise test using heart rate and workload on the treadmill, so an increasing stage and incline. Flexibility, we're going to do the sit and reach after that treadmill test. We'll do hand grip, and then strength, upper and lower body, 1 or 3 to 5 rep max. So to think about that as we wrap up, a couple things to do after this is you guys are going to, you have a cardiorespiratory fitness pre-lab quiz to complete. If you can hop on Carmen, it's in your lab assignment for this week. It's under that there, kind of just under where this lecture was. If you can complete that before you attend your in-person lab. It's a lot that we cover in that hour and 20 minutes, so we want to kind of give you guys this background before we jump in and kind of run through all the tests and procedures. And then if you want to be a subject, email your instructor individually. So whether it's Barbara, Steph, Emily, or myself, email us if you want to be the volunteer for all of those tests. So you'll get a circumference, skin fold, you'll do our treadmill test, flexibility and hand grip, and then the 1RM. So you'll get the full comprehensive. Thanks for listening today. We're excited to see you guys in lab for this full. It's a fun time. We do run through a lot. So if you have questions, come prepared with those. We'd love to answer them. And we're excited to see you guys again for in-person lab this week.